Coronavirus infections are on the rise in Europe. Tougher restrictions and lockdowns are back in place in many countries. But why are they struggling to contain the pandemic? And what went wrong with the rollout of vaccines? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. Europe saw a downturn in coronavirus cases at the beginning of this year. But now infections are soaring in the majority of countries, with more than 1.6 million cases recorded last week. The World Health Organization says the rapid surge is worrying, and it's warned what it calls the continent's unacceptably slow rollout of vaccines could prolong the pandemic. Europe's inoculation program has been hit partly by delivery delays. And that's led some countries to reimpose restrictions and lockdowns, with many tightening their rules for the Easter holiday. Nadim Baba reports from London.
A weekend in Rome and people out and about enjoying the Easter break. But reminders of the COVID-19 restrictions are never far away.
It's been more than a year now since the first restrictive measures were imposed in Italy. We were probably among the first countries to confront this emergency, and people are tired, but they're aware that protecting health is essential in these times.
All regions are now classified as red zones. People can leave home to exercise or to visit relatives once a day. But police are checking nobody's travelling between regions.
I'm glad they are doing checks. It means something is working in this whole mess.
Over in Lyon, in southeastern France, this man was one of thousands getting a coronavirus jab inside the city football stadium on Saturday. With intensive care units as full as they were last April, the country's speeding up its vaccination programme over Easter.
For us volunteers and for the people who come here, these are quite stressful times. So by doing this, hopefully we can get through it more quickly.
From Saturday, there's a nationwide curfew between 7 p.m. and 6 a.m. President Emmanuel Macron says authorities will take a relaxed view this weekend if people travel beyond the permitted 10 kilometres. But from Monday night, they'll be checking such journeys are essential. In Spain, traditional Easter processions are cancelled, but in Barcelona, some have been making the most of the weather. Spain's still in a state of emergency and new cases have been rising. A new national law says people have to wear a mask outdoors, and gatherings of more than 6 people are banned in this region, but here at least they're taking a measured approach. In Britain, police forces have asked people not to travel long distances over the holiday, while the Prime Minister's issued his own reminder.
You can meet up as 2 households or 6 people outside. Always remember, outside is much safer than indoors as far as spreading the virus.
The speed of the UK's vaccination programme means the government's on track with what it calls its cautious, irreversible roadmap to freedom. But it's still urging the public to be careful. Nadim Baba, Al Jazeera, London.
The EU's vaccine rollout has fared poorly compared to other developed economies. So far, only around 10% of the bloc's 900 million people have received even one vaccine dose. In the UK, nearly half the population of 67 million have had a first jab. In the United States, President Joe Biden is promising to deliver 200 million shots by the end of the month. So far, almost 30% of people in America have received a dose. The slow pace of the EU's vaccination campaign could hamper economic recovery. The bloc is predicted to grow less than 4% next year. The US and UK are expecting nearly double that. All right, let's bring in our guests in Reading in the UK. We have Simon Clarke, Associate Professor in Cellular Microbiology at the University of Reading. In Grenoble in France, Bary Pradelski, Associate Professor of Economics at the National Center for Scientific Research. And in Würzburg, Germany, Ulrich Bruckner, political analyst and EU Jean Monnet professor at Stanford University in Berlin. Welcome, all of you, to the program. Ulrich, let me start with you today. So the World Health Organization has sharply criticized Europe's vaccine rollout as unacceptably slow. Just how bad is the situation currently, and how much could this potentially be prolonging the pandemic in Europe?
Well, of course, it would be much better if we would have a blueprint that we could apply from previous examples, but this is not the case. It's the first time that the European Union, as a coordinating body, is responsible for something like managing a pandemic. And what we discuss in Europe is that it makes much more sense to join forces and to prepare everything collectively. But as it turns out, this is much slower and far less effective than what we can experience in Israel, in the United Kingdom, or in the United States. It doesn't mean that it was the wrong approach, but that is something we only learn in retrospection.
Simon, the WHO has also warned that the speed with which the virus is spreading could increase the risk of new variants developing in the region. How real is that threat? And from your vantage point, how worrying is it?
It's a very real threat. The more transfer of virus you get from person to person, and then again from person to person, the more virus is produced. And every time a new virus particle is produced, there is the opportunity for a new variant to arise. And they will arise all the time. But very rarely you will get a new variant which transmits better, or perhaps is more virulent, more able to cause disease, or perhaps maybe less sensitive to the actions of the vaccine. So allowing the virus to spread just simply increases the chance of mutation.
Bary, how dire an effect is all of this having on European economies right now? And how much will these new restrictions disrupt supply chains and factories, especially for countries like Spain and France and Germany, countries whose economies are really interlinked?
Yeah, so I think the impact on the economy is tremendous, and we'll see likely short, mid, and long-term impact of the poor strategy being rolled out in Europe and in most parts of the West. If you look now at countries who have implemented elimination, a zero-COVID strategy, they are back to growth. Countries like China, Australia, New Zealand, and many others have GDP predictions for 2021 over 2019, which are plus 5%. On the other hand, in Europe, we are predicted in 2021 to be 3.5% below 2019 still. So this will have very long-term effects for Europe's economy, as there's this uncertainty of yo-yo effects, prolonged lockdowns, and there is no investments. It's hampering investments in assets, but also in labor. So I think the global balance of economic power will really shift if Europe is not swiftly acting to get control over the virus.
So, as we know, Germany is one of the countries that's imposed strict pandemic restrictions. The president says the health situation has led to a crisis of trust in government policies. Frank-Walter Steinmeier on Saturday conceded there were mistakes and urged Germans to pull together.
Your expectation for those in government is clear. Get it together. Let's all get together, dear compatriots. Let's bring forth what we are made of. We are not world champions in dealing with the pandemic, but we're not a total failure either. We are the Republic of Germany. We doubt a lot, but we're capable of a lot. And it's capability, not doubt, that counts now.
Ulrich, do statements like that you just heard from the German president signal to you that European leaders are learning from past mistakes at this point?
Well, they do learn from past mistakes, but we constantly find ourselves in a new situation because the pandemic doesn't follow a script. What the situation is today is very different from last year, and domestically the situation changes a lot. Germany is sort of slowly getting into an election campaign. We will replace Angela Merkel as the chancellor who was in the chancellery since 2005. And this also changes the way politicians talk about the pandemic, and it resonates in the public. So the debate is different, as well as the challenge of the pandemic.
Simon, does the EU have enough vaccines to slow the spread of coronavirus?
I'm not sure we know how much stock they've got that's not being administered or isn't waiting to be second dose for some people. But I've heard stories of over 1 million doses of Oxford AstraZeneca sat on shelves in France. I don't know how true that is. But also, if they're not giving it to certain people, then why have it? What's the use of it? But it does seem that there isn't enough vaccine, generally speaking, across the EU, particularly in certain countries. And that, of course, will mean that it's much more difficult to keep a lid on infection numbers when they're finally brought under control.
Bary, how bad a job did the European Commission do when it came to negotiating with vaccine companies and manufacturers?
Well, I think it's not only the European Commission to blame. I think we have in Europe this problem that the responsibility of the European Commission was not given before, as Ulrich has mentioned. So I think that also the member countries could have done a better job to support the Commission. Fundamental market forces were just really not understood. And if we would have invested like other countries, like the US, the UK, or Israel, early on, not only saying we'll procure vaccines, but invest into production capacities, collaborate with the different companies who had candidate vaccines, we could have actually produced much more. So the argument is that some countries like the US, UK, Israel have been selfish is a smokescreen. By supporting companies and creating the right incentives, Europe could have led to an increased production. So there would be more vaccinations for everyone right now.
Ulrich, how much did the EU underestimate possible complications and delays in vaccine production? From your vantage point, what were the biggest mistakes made by the EU when it came to vaccine procurement?
Well, if we compare the European Union with what happened in the United States, the approach was very different. It was kind of a legalistic, we sign a contract with a company that produces a certain amount and then we are fine, like driving at sight. But in the United States, it was a much more market economy approach in which they came with a lot of money and incentives, and it was kind of a rat race to find out who's the winner, who can benefit the most from this huge incentive to produce on a large scale in a short time. And that was a very different approach. And now the United States can provide vaccine on a much larger scale. And Joe Biden is doing a much better job than any leader in the European Union. But that is, as we said before, not just the problem of the European Commission. It was just a different approach. And apparently it didn't lead to the same successes as in the countries that do much better than the EU members.
Simon, EU member states are allowed to strike separate deals with vaccine makers that have not signed agreements directly with the EU. You know, from your perspective, does that help the situation or does that complicate it further?
Maybe it complicates it. I don't quite know the details of how the European Commission distributes vaccines, but it might take a look at what other countries do. Germany has bought, I think, quite a few doses of the Pfizer vaccine. But countries like Hungary have purchased large quantities of the Sputnik 5 vaccine. So Sputnik V, sorry. So really that changes the picture in terms of how many total doses of a vaccine a country has. And really you have to ask the question, I think, if that's within the rules, then what is the point of having a coordinated system?
Bary, when it comes to economic recovery, how are EU countries doing compared to other countries whose economies have been ravaged by the pandemic?
They're doing very poorly. So if we look at Europe, we are still right now in many countries in the third lockdown. In many Asian countries, also in Australia and New Zealand, where elimination was favored as a strategy, they are almost beyond the pandemic. The service sector has recovered since last spring 2020. And also if we look at GDP numbers, numbers are back to pre-crisis growth, whereas in Europe we are still minus 4% below 2019 levels. And importantly to mention this is while in Europe we have almost 50 times more deaths than in countries who opted for elimination. So the whole idea of health versus wealth and prosperity here is, after 12 months of the pandemic, really refuted. And we see now that those who reduce the death by quickly aiming for elimination and doing rollouts of testing and of vaccinations, they also are able to go back to economic growth and economic stability.
Ulrich, how big of a problem in Europe right now is vaccine hesitancy? And has the fact that the rollout of the vaccine been so sluggish in EU countries impacted how people think about the vaccine? And has it perhaps increased the levels of hesitancy?
Well, the political price is certainly very high. And what is said about the upcoming elections, not only in Germany, but also in France next year, will be massively affected by how much do we trust in the communication policy of the people in power? So this is definitely a high price we pay. On the other hand, countries like France have been always very reluctant to trust in vaccination in general. And now we see that many more people are willing to go for a treatment because they believe that it's much better than trial and error and figure out if the long-term consequences are worth taking the risk. So there is a different attitude towards it, but I think politically speaking, the costs are certainly the highest.
Simon, there are some EU countries that paused their rollouts of the AstraZeneca vaccine over reports of blood clots among a small number of people who'd received a dose of that AstraZeneca vaccine. Other countries restricted its use among older people over concerns that the company had not provided enough testing data. The WHO and the European Medicines Agency say the benefits of the vaccine outweigh any risks. But how much has this entire issue and the coverage of it impacted public confidence in the vaccine? And how much has it complicated the rollout of the vaccine?
Well, I think the public confidence will only know about that in time. It's, I think, inevitable that it will grab people's attention. But it really is important with something like this to be clear with people that by listening to or being concerned about one set of risks, that is the possibility of blood clots, you're ignoring a much bigger risk, and that is from COVID-19. So I think people's perceptions of risk are really important and really need to be, people really need to be helped in understanding the relative risk between this tiny risk, it seems, of blood clot. We're not actually sure whether it's any higher than the general unvaccinated population, and the risk from picking up the virus and getting seriously ill from it.
Bary, I saw you nodding along to some of what Simon was saying there. Did you want to jump in?
Yes, I think the vaccine hesitancy, first of all, is often overclaimed because many people are hesitant but then take the vaccine. But it is, as Simon said, it's very important to note, as a government, it's clear that they need to be careful not to administer a vaccine which is putting the population at risk. But the overall risk is still minuscule compared to the risk of COVID. And the risk of COVID is not only high for, as it's often claimed, for the older population, but it's also high for the younger population. There are many cases of long COVID now, with heart problems among young people, with chronic fatigue. So I think it's very important to understand that for everybody, even in their own interest, not only on a population basis, taking the vaccine is the right choice.
Simon, let me go back to you because I saw you reacting a lot to what Bary was saying there. See if you wanted to also go ahead and expand on that.
Yeah, I agree with everything he said there. I think the risk, particularly to younger people, is understated, or it has been in the UK anyway. Here in the UK, during basically over the past 12 months, we've had more men in their 40s admitted to our intensive care units with COVID-19 than people, men and women, over 85. So there is this perception that anybody below about 60 really isn't risk, and in their 50s, well, you'll be very unlucky if you get seriously ill. It's false and it's dangerous.
Ulrich, how much have the disputes between the EU and Britain over exports of the AstraZeneca vaccine complicated the overall situation when it comes to the rollout?
Well, we had already a very complicated situation because of the endless debates we had over Brexit. And I think this is just another chapter. And we are in the middle of complicated trade deals and mutual distrust and whatever stories exist on both sides of the channel. So it is just another important dimension in a very complicated relationship right now.
I mean, just to follow up with you, Ulrich, I mean, what you're kind of talking about there is, these divisions that exist within leadership in the EU. I mean, this really has put a spotlight on, all the bureaucracy that the EU deals with, how difficult it is to come to agreement, has it not?
Well, it's not so much a question of bureaucracy. It's the very nature of the European Union as something which is not the United States of Europe. This is a group of sovereign states that coordinate certain policies on a supranational level. And they had decided in the past that they do something in health, like the registration of new pharmaceuticals. but they have never decided that a pandemic should be centrally steered or coordinated. And now the European Commission and the different bodies that are involved, including the heads of state and government, they learn the hard way what it's like to coordinate something that in a much more centralized political system is national leaders decide on behalf of the whole country. So we might see, similar to previous crises, greater appetite to coordinate more on a European level, but that will certainly affect the very nature of the sovereign member states, and whether each and every country is willing to pay this political price remains to be seen.
Bary, what needs to happen in order to get things back on track economically throughout Europe?
Well, I think that coordination is very important. And Ulrich mentioned that the problem is that the European Union is not the United States of Europe, but we have the principle of subsidiarity, which states that Europe should act when it's better placed than its member states. And clearly, epidemiologically and economically, Europe is highly interconnected. So I think Europe should now, where they already opted this way, and actually the Commission and also the European Council, the European Centre for Disease Control also have taken many joint steps. They should act together and implement joint policies. They implemented green zoning, where they try to protect green zones where travel is allowed between, which could be extremely important to economically come back on the feet. In particular, like for the southern European countries, is tourism. If we are able to allow some of the tourist season to happen within Europe by allowing people to travel between countries when it is safe to do so, would be very important for economic prosperity in Europe, and also not further increase the gap between the south and the north, which already exists in Europe.
Ulrich, I saw you nodding to some of what Bary was saying. Did you want to jump in?
Yeah, if we just take a country like Greece, which its most important sector is tourism, their loss is 70%. If they don't find any alternative way of organizing safe systems to allow people to get the well-needed tourism and go on vacation, it's not only terrible for the country, but it's also coming with a lot of mental consequences that have also not been addressed in the beginning, when it was all about how can we save lives. So there are so many different overlapping rationales in the whole function that in the term of the pandemic, we learned that we also have to include other points of view and to find a balance, and that makes it so incredibly hard to decide what is right and what is the wrong decision.
Simon, the European Commission said last month that it was considering emergency approvals for vaccines. Do we know where that stands currently?
No, they will be making their decisions privately, and as far as I'm aware, they'll be having discussions with the regulators in member states, who will all have their own views and preferences and questions that they will want addressed before anything is approved. But I don't think we know at what stage any of those processes is at.
Ulrich, we only have about a minute left. Let me just ask you generally, which countries in the EU are facing the biggest challenges right now?
Well, from what I see from the numbers, Sweden, that was always a special case, sees a very high number of infections. But this is more from the health point of view. When we look at the political consequences and the fatigue, I wouldn't put Germany very high, because people generally are very satisfied with their political leaders. But if we would have elections not in September, but next week, the current coalition will face a massive loss. So the pandemic will have political consequences. This can still change over the summer, but it remains to be seen if the government is willing and able to convince the people that they're doing the right thing.
All right, we've run out of time, so we're going to have to leave the conversation there. Thank you so much to all of our guests, Simon Clarke, Bary Pradelski, and Ulrich Bruckner. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed, Jamjoom, and the whole team here, bye for now.